I love that.
Well, here we are. Thanks for watching. And we always like to roll in with someone telling a joke. We're here with John Kaufman, Charisma Lewis, Greg Harduk, who's the founder of Versicode, who's our kind of in the hot seat today, and Nathan Kaufman here. And we're talking about HCC coding. We're talking about the medical space and being an entrepreneur. Greg, I'd like to introduce you. You're into a lot of really interesting things right now. Tell us a little bit about yourself.
Yeah, so I have a really unique and diverse background. So I'm a registered nurse and a risk adjustment coder, obviously co-founder of Versicode, but healthcare is actually a second career for me. My first career was in something totally different. So I studied for years. I studied music, and I studied to be a music teacher. Went to undergrad and got my master's at the Eastman School of Music here in Rochester, New York. And I thought for my whole life that was going to be my career path, and that was the direction I headed. That turned out not to be the right fit for me, so I made an abrupt change and switched into the healthcare space and went back to nursing school. So I have a pretty diverse background, having studied in the arts for quite a while and then totally switched gears and studied in the sciences. And I think that really gives me a unique perspective on things. It allows me to make some observations and connections that are maybe outside of the box a little bit. And ultimately, I think that benefits our clients by providing extra value and maybe seeing things that get overlooked other times.
Yeah, I like that combination for sure. We see a lot of interesting combinations, and it comes down to sometimes it's just interesting people trying to figure stuff out. They end up in this field, that field, the other.
Yep.
John is, you're kind of into a few different things as well. Charisma, I think you're in a couple spaces. Greg, what is kind of keeping you motivated right now?
Yeah, well, that's really what we're all doing, right? We're all just trying to be interesting, diverse people and also make our way in the world and do the best we can. So I have many different motivations. Some of it just comes from inside, and I've always had an entrepreneurial mindset ever since I was a kid. I was the kind of kid that would, save snacks from home and take them to school and sell them to my friends, or sell pencils at school, stuff like that. So that's always been a part of me. And then, of course, motivated by providing for my family and for my kids. But a lot of it is I'm just passionate about the space. I've worked in healthcare for a number of years now, and I've worked closely with a lot of different kinds of healthcare organizations and healthcare providers. And just the amount of administrative burden that is on them and keeps being added to them year after year is just tremendous. And I really believe that doctors should be doctoring, nurses should be nursing, surgeons should be surgeoning, and that we should be able to take some of that administrative burden off of them. So that's something I'm really passionate about. I've been in the trenches in healthcare and just seen how crazy it drives physicians to have to fill out more and more paperwork. So I'm passionate about freeing them up to let them do what they're capable of. So that's what drives me.
Yeah, well, that's great. That's great. You guys have some questions for Greg?
Yeah, this is Charisma again. I love the fact that you are very passionate about what you do and that you have a wide range of perspective. But more importantly, you're in the healthcare trenches and identifying some of these improvements that we can do in the medical field. So can you tell us about what's unique in working with Versicode?
Yeah, so I think what makes us unique is our people and our technology, and then our vision. And I'll tell you what that vision is in a second. So one of the things that makes us unique is our people. So working with Versicode, you'll have a personalized experience. You're going to have a one-on-one experience working with somebody. The onboarding process, the training process, very simple. But you're not going to be tossed around between a bunch of different people. You'll have a small group of people that work with you. And that really helps because we want to make that personal connection. And we're all clinicians. We all have clinical experience. So we really know what life is like in the trenches on a day-to-day basis. I think our technology is also unique. We have an interesting blend of, when it comes to coding, artificial intelligence and human intelligence. So there's a lot of risk adjustment companies out there that do one or the other, a lot of human coding or a lot of AI coding. But I think there's benefits that AI can bring to the table that humans cannot achieve. But there's also a layer of intelligence that humans bring to the table that AI is never going to achieve. So we merge those in a really unique and interesting way. And then I think the final thing is our vision. With us being clinicians by training, all of our software, all of our programs, all of our products are built by clinicians for clinicians. So like I said earlier, we believe doctors should be doctoring and surgeons should be surgeoning. And we build all of our products with the best clinical workflows in mind, to really free up the provider from paperwork time so they can spend more time with people and less time with paperwork.
Yeah, excellent. A lot of layers. John, you got some questions for Greg?
Yeah, I have a couple questions for Greg. Well, many, but from our previous talk, what comes to mind is Versicode is very unique, and it seems to be at the front of a lot of the technology that people are now just starting to catch up with. What makes Versicode most unique, from other healthcare organizations, and as a risk adjust vendor, what makes you different?
Yeah, so I'm going to hijack your question a little bit and go a little bit different direction, because we talked a little bit about some of the uniqueness just a second ago, but you did mention that we're kind of at the forefront of this wave. And I don't know if you just said that or if you said that earlier, but the way healthcare reimbursement is going, the way Medicare goes, so goes all healthcare reimbursement. And you can just see this coming like from a mile away. Right now, depending on what layer of the healthcare space you're in, risk adjustment may be optional for you, or it may not be. But if you're in one of those places where it's optional, it's not going to be optional for much longer.
Right.
They're pushing to pass the risk down to lower and lower levels, to the point where individual solo providers are going to be bearing risk for the health of their patient. And that really comes down to making sure that you have the right benchmark set. And that's what risk adjustment coding does, is it sets the correct benchmark. Because I know this as a clinician and working in the field, when you have a patient in front of you, you're focused on what the patient needs. You're not necessarily focused on getting the exact right code and getting all the codes. And there might be 30 of them and you only have time to address 5 things. So currently that's optional, but in a year or 2 or 3, it's going to be required. So you can sit on your hands and you can wait until it's required, but then they're going to go back and use coding and clinical data from 2018, 2019, 2020. You're going to be a couple years behind the curve, and you're going to be under reimbursed for the work that you're doing. So it would be wise to at least consider checking into the risk adjustment space now, so you're prepared when that wave comes. Or even get it prepared ahead of time, because right now it's a small investment up front, with a very large return not that far in the future.
I like that. So a lot of people are going to be paddling out to the wave that you guys are already on in a few years.
Absolutely. And that's, you asked, it was asked earlier, what's my motivation? That's one of my motivations. Is I don't want to see people struggling paddling in the water. I want to help them reach out to that wave. So we're looking to partner with those kind of people that see the wave coming and need help getting there. We want to be your partner in helping you with that.
Great vision.
Greg, on that note, and yeah, that's a great answer. And it's always, interesting to think about what is someone's organization on the forefront of, and really being able to define that and being on the forefront of the fact that this risk is moving different places. And, who we talk to on a daily or weekly basis, different parts of the, the healthcare world, it's anybody's guess sometimes. And there is a lot of, their feelings of concern. And so being on the forefront of making sure that's addressed, that's a great that's a great place to be right now in the medical space for sure.
Yeah.
Now, you started to mention some things about, you know, the types of people you want to help get there. What does a good engagement look like for Versicode right now? I know it's a couple different layers. You can work with the freelancers, you can work with the some of the staffing organizations or direct. Maybe just touch on a few of those, what those engagements look like, and paint the picture of what it's like to work with Versicode.
Sure. Well, the short answer is any healthcare organization that has any contracts or payments based on risk, which is usually benchmarked to the health conditions of a patient. So if you have any contract or reimbursement mechanisms in place that are risk referenced, you would be a potential person to work with us. The longer answer is we're really looking to help healthcare organizations like provider organizations, medical groups, ACOs, IPAs, stuff like that, or even smaller groups, individual providers, surgical centers, things like those kinds of organizations. But really, again, the short answer is anybody who bears any risk and reimbursement in the healthcare space.
Which we're seeing is a lot. There's many.
Yeah, it is, and it's
many
coming.
organizations,
it's coming
right?
Even more. So, like I said, if you don't bear that risk now, you're probably going to in a year or two or three.
Right.
But it's really
Right.
not just about working with us and paying us money, and we provide you a service and some software and some partnership. It's really, we're really looking to build relationships. So even if you're not in a place right now where you're looking to make a move on integrating some software or bringing in a risk adjustment vendor or something like that, we're still looking to build those relationships to give you that helping hand out to that wave. If that involves doing business together, great. If it doesn't, great. We have lots of other things that we're doing in the space to provide education and resources. These kinds of calls, you know, we'd love to have you on one of these kinds of things. You know, co-work on some content together, really just to bring awareness and education to the space. So it's not just about doing business together. It's about really building a relationship.
Yeah, and I would say that the competition in this is inaction. It's not any particular organization, and having that kind of big tent approach is we need to get more innovators in that space together on the fact that this is a big area that needs to be addressed. So you're on LinkedIn, you're on YouTube, obviously, Facebook. Yeah. We'll spread the word on some of those things. Charisma and John, thanks for jumping on, and Greg, we'll be looking forward to recording some more real soon.
Awesome. Thank you all.
Thank you, everyone.
Thank you.
Great, Greg.